Hi, it's Dr. Jordan Tishler from InhaleMD. Today I've been asked to talk about my perspective on marijuana strains. And I feel like I'm going to go out on a limb here with you guys today and say something that's somewhat heretical. Certainly, if you have any experience in the cannabis world, you know that the first thing that anybody ever wants to talk about is this strain, and they all have these wonderful, colorful names and whatnot. And, people want to say, oh, well, is this a sativa or is this an indica and all that sort of stuff. And what I'm really here to say today is that a whole lot of that is marketing hype. In my experience and the experience of my patients, isn't that much difference. High quality cannabis is good medicine, but nitpicking about this strain versus that strain doesn't seem to have a lot to do with clinical outcomes, meaning any marijuana is likely to make you better. Now, that said, I do believe that there are differences between the various strains, but they're sort of like the differences between they're sort of a matter of preference. When you go to the store for a headache remedy, do you buy Advil or Motrin? Well, quite frankly, the same ingredient in both of them, but people will swear that Advil is the right one for them or Motrin is the right one for them. And it's a matter of preference. And I think that that's really what we get when we're talking about strains. So don't take away from this that strains don't do anything different, but really take away that the medical outcome, the effect on your illness, is not going to vary very much with the cannabis strain. I see this in about 95% of my patients. The other 5% really think that the strain is very important, and it's a little hard to know what to make of that group and those numbers. But at least the vast majority of my patients find that any cannabis is good cannabis. So, that being said, is Dr. Jordan Tishler from InhaleMD.